What is the difference between a nurse practitioner and a medical doctor? Hi, I'm Frank Spector, medical malpractice lawyer in Maryland and in DC. Years ago, there were really doctors and nurses, and we had a clear understanding as patients about what the role of a doctor is and what the role of a nurse is. And both of these, both doctors and nurses, have a vital role to play in the care of patients. But today, we have many different types of healthcare providers that we didn't have before. And today I'd like to talk about the nurse practitioner. Many of us who now go in to see our doctors, whether we go into our family doctor or maybe even some specialty care, instead of seeing a doctor, we are seeing a nurse practitioner. So I think it's important to discuss what is a nurse practitioner and how is that different from a medical doctor. Now, let me just begin by saying that nurse practitioners do provide a very useful part of our healthcare system. They are trained, but they don't have the same level of training as a doctor. And by no means in this video am I disparaging nurse practitioners, but I think it's important, as I'd like to do in all these videos, is to provide you with all the information so that you know and you can make the most informed decisions for yourself. Okay, so let's talk about a doctor. A doctor is someone who goes 4 years of college, then they must take rigorous examinations to apply to medical school. Going to medical school is extremely competitive. Most of the people who apply to medical school do not get in. Once you get to medical school, it's a very vigorous 4-year course of study where you have exposure to many different areas of medicine. And then after you graduate from medical school, again, you have to apply and be accepted into what's called a residency program. And just like getting into medical school, these residency programs are extremely competitive. And not every medical doctor who graduates medical school gets into one of these residency programs. A residency program is 4 years, and that exposes the doctor in a hospital setting to many different specialties of medicine. And they work under senior doctors, trained doctors, who expose them to different scenarios, who watch them and train them, who test them and make sure that what they're doing is accurate. Again, that's 4 years. Sometimes they're working, 50, 60 hours a week in a hospital doing their residency. Once that residency is over, they have to sometimes go for what's called a fellowship. That's the next level. So if they really want to be a specialist in some area, they need to have more rigorous training so that they can become the best that they can be in that specialty. And if they want to become certified, it's called board certified, they have to study for and take a series of rigorous examinations where they have a written component and they have a component where they have to answer questions verbally. And that's done in front of very well-trained doctors. And again, they're very difficult examinations and not many people pass them on their first attempt. Now let's talk about a nurse practitioner. Nurse practitioner does not have that level of training. They don't go to medical school. They don't have a residency. The training for a doctor can be 8, 10, 12 years. Most nurse practitioner programs allow a nurse practitioner to get their certification within 2 to 3 years. Nurse practitioners really are a more advanced type of registered nurse, the nurses that maybe we're most familiar with. So the level of training that a nurse practitioner has as compared to a doctor is very, very different. Doctors are also trained in the hospital for many, many years, as I've explained. Nurse practitioners do not have that level of training. Nurse practitioners, they are principally making diagnosis in an office setting. Nurse practitioners do not operate. Nurse practitioners don't have that level of training that would allow them to perform medical procedures. So nurse practitioning programs, many of them can often be online, whereas medical school is in person and live. And honestly, the training in medical school is much more rigorous and much more thorough than a nurse practitioner. So why are there nurse practitioners? Well, for the most part, when people come in to see a doctor, if they have the flu or COVID, or they have some, basic things that happen to them, it's very easy for a nurse practitioner who has that experience to be able to make those diagnoses. They see that a lot. They can interpret lab results. They can deal with the more basic and even a little bit more basic medical conditions. But the issue with nurse practitioners is they have to know when something is beyond their expertise, and they must be under the supervision of a doctor. So in a setting where you're seeing a nurse practitioner, I would just caution you just to make sure that if you have something that's very complicated, it's probably going to be beyond the scope of a nurse practitioner. And sometimes we find that nurse practitioners go above what they are trained to do, and they may be putting themselves in situations where they don't have the training. So I just wanted to provide this information for you so that you can have a better understanding of the difference between a nurse practitioner and a medical doctor. Now, the question may be, well, if something goes wrong, can I sue a nurse practitioner for malpractice? And the answer is yes, of course you can. You can sue a nurse practitioner. They are held to the standards of care, and they have an obligation to treat the patients within those standards of care. And if they don't do that, if they fall below those standards of care, they are subject to a lawsuit just like a medical doctor. So I hope you found this video informative. Please hit that subscribe button. And that way you can take advantage of all of my videos. I'm trying to put out a lot of good content so that you are made aware of a lot of these issues that happen in the medical field and in the medical world, and that you can make good decisions for yourself. So if you hit that subscribe button, you're going to be able to take advantage of my videos, and it really helps me out a lot too. I really appreciate you taking the time to watch this video. On my website, which is frankspectorlaw.com, I have a lot of great content, a lot of information about all types of medical malpractice, and you can look at my YouTube channel, Frank Spector Law. That's my YouTube channel. I'm posting videos there very frequently. I have a lot of topics that I think you'd find interesting, so I look forward to seeing you again on another video. Take care and have a great day.